Dear doctors, welcome back to EasyMed. Today we'll discuss about chronic pelvic infection. In the previous videos, I have covered about the defenses of the female genital tract. I have talked about the pelvic inflammatory disease, its symptoms, differential diagnostics, and therapy management on an inpatient and outpatient basis. If you haven't watched those videos, you might go and watch those videos first and then come back here. So let's start with chronic pelvic infection. Chronic pelvic infection. So here, for easy understanding, I have given a diagram of the uterus. You can see we have the endometrium, the cervix here, and the parametrium. So from a clinician's point of view, for examination of a female genital tract, you should be very, very aware about the incidences in the parametrium. Any destructive pathological process, it might be cancer, it might be tuberculosis, it might be some chronic infection, and it might be some fistula as well. And these things always spread through regions, all these regions of the main genital organ parts, like the vagina, the cervix, okay, then the endometrium, the myometrium, then it spreads to parametrium. And basically, if you palpate the rectum, if you palpate the genitalia, if you try to palpate the genitalia through rectum, you might feel the destructive processes happening in the parametrium. So that's why I have given this diagram and tried to explain it to you first. Let's come to chronic pelvic infection now. So the pathology, this is mostly not found in uterus due to endometrial shedding. This is mostly not found in uterus. Mostly not found. Where? In uterus. Why it is not found? Because of shedding or menses. Now the peritoneal surface produce adhesion due to the infection. Okay, the peritoneal surface produce adhesion because of the infection. Now this adhesion might be of two types by consistency or nature. It might be a flimsy adhesion, or a dense adhesion, Now, as a doctor, or maybe as a gynecologist, you might suspect that from a clinician's point of view, might suspect that this flimsy adhesion is a gonococcal infection, because it happens in most of the cases. And if there is dense adhesion, this is non-gonococcal. Now, what are the symptoms? symptom is chronic pelvic pain prior to menstruation. There is chronic pelvic pain prior to menstruation. Then dyspareunia, that is pain during coitus or sex. There might be congestive dysmenorrhea. There might be meno or polymenorrhea. You might find a mucoid vaginal discharge. A mucoid vaginal discharge, and there might be infertility. Now, examination. How you will do the examination. Basically, there are three modalities of examination. One is per abdomen examination, per vaginum, and per rectal examination. Now, per abdomen examination, what you will find, what are the findings? The finding is you will find tender iliac fossa. The iliac fossa will be tender or soft to touch, tender iliac fossa. And you might feel an irregular tender pelvic mass. There will be a soft mass which will be irregular. So irregular, soft pelvic mass. Per vaginum, you should examine the parametrium, as I have already stressed on it, and the uterosacral ligament. Excuse me, this is per rectal, as I have said. Through rectum you observe the parametrium, and per vaginum this is per rectal, and per vaginum examination you just observe for irregularities. Anatomical irregularities. Now, looking in the diagram, this is a diagram of bimanual examination. This is a diagram of bimanual examination. So, how to perform a bimanual examination? You should keep one hand over the mons pubis area, and with another hand you should place the another hand like this. You have 90 degrees here like this, and you might like this you might examine the vagina. Here you can see it is this position is vagina. Okay, you might examine the vagina, and in the same manner you might examine the rectum as well. Now, investigation. What investigations should be carried out in suspected cases of chronic pelvic infection? You should always go for blood CBC, that is complete blood count, and you will find there high WBCs, that is leukocytosis, and a laparoscopic examination, laparoscopy. And on laparoscopy you can get a this is a confirmatory test. This is confirmatory test. Why? Because through laparoscopy you can find inflammation. What else? You might see fluid in Douglas pouch, and other peculiarities which are to be observed in any case, any inflammatory disease. Now, management. Let's come to management. Now we can divide the management in three groups. A general management, that is based on improvement of the patient condition. There might be a specific management, that is use of broad spectrum long acting antibiotic therapy. Okay, use of broad spectrum antibiotic therapy. Usually we use tetracycline, preferably doxycycline, or we use cephalosporin. And the duration is usually 3 weeks. And last option is surgery, but this is done in negligible amount of cases, in very few cases, very rare. And the approach, if you talk about the approach might be two. The approach, one approach might be a laparoscopic intervention, laparoscopy, or laparotomy. Okay. For medicos, if you are confused about laparoscopy and laparoscopy, as you know, basically in laparoscopy we do incisions. In most of the cases we perform 3 incisions, one in the left side, anywhere in the epigastrium, mesogastrium, or hypogastrium. That depends on the case, the surgical case. We do one on the left side, one on the right side, and we do another incision in the umbilicus, and we insert one laparoscopic apparatus used like a clamp through one incision, and through another incision we insert laparoscopic, it might be a bipolar, it might be a monopolar, or a laparoscopic scissor, and through the umbilicus we insert the camera. And laparotomy is we do a long incision over the stomach, not over the stomach but over the belly. We do a long incision over the belly. We use retractors to retract the belly, and we operate on it. and after the process we incise and close it. So this was all about the chronic pelvic infection. I hope you liked the video. Please do support the channel by sharing it amongst your friends and subscribing to the channel, pressing the bell icon. In the next part we will discuss about some peculiarities like genital tuberculosis. We will discuss about pelvic inflammatory diseases which occurs after gynecological procedure or after delivery of postpartum, like this. Thank you. Please like the video, comment on it, share it amongst your friends, subscribe to our channel, and don't forget to hit the bell icon.